China reported the number of infected medical workers for the first time. China disclosed on Friday that 1,716 medical workers have contracted the virus and 6 of them have died. The announcement was the first official confirmation about the number of infected medical workers, and is likely to ratchet up fears about the spread of the virus. Zheng Yixin, deputy director of the National Health Commission, said the numbers of infected workers represent 3.8% of China's overall confirmed infections. The victims represent 0.4% of all deaths nationwide. Mr. Zheng said that Hubei, the province at the center of the outbreak, recorded 1,502 cases of infected medical workers, with 1,102 of them in Wuhan, the provincial capital. He added that further research was needed to ascertain whether the infection spread throughout the hospital or within the community. "I think it's quite concerning," said Benjamin Cowling, a professor of epidemiology at the University of Hong Kong. Healthcare workers face the challenge of caring for a substantial number of patients in Wuhan. It's worrying to discover that a number of them have been infected. Medical workers in Hubei, already working round the clock, face a shortage of personal protective equipment such as masks, gowns and safety goggles. They have resorted to begging from friends, putting out frequent calls for donations, and using tape to patch up torn masks and gowns. Many doctors and nurses there say they eat only one meal a day because going to the restroom means removing and discarding safety gowns that they would not be able to replace. During the SARS outbreak of 2002-2003, 961 medical workers were infected, representing 18% of all infections, according to government data. About 1% of the medical workers infected with SARS died, the medical expert Xu Dezong told Xinhua, China's official news agency. A senior health official in Wuhan, China, the center of the outbreak, has called on residents who have recovered from the coronavirus to donate blood plasma, believing their naturally produced antibodies could be used to treat patients who are still sick. Dr. Zhang Dingyu, the director of the Jinyintan Hospital in Wuhan, made his appeal on Thursday after Chinese researchers said they believed such antibody treatments could help people recover from the virus. The search for a drug capable of treating or curing the virus has frustrated researchers. As rates of infection and deaths continue to mount, the government is currently prescribing a combination of antiviral drugs and traditional Chinese medicine. But on Thursday, China National Biotech Group, a state-owned company under the Ministry of Health, said it found that administering a round of human antibodies from the survivors to more than 10 critically ill patients caused inflammation levels to drop significantly after 12 to 24 hours of treatment.